everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication or a supplement known as vitamin D. Another name for vitamin D would be cholecalciferol. In terms of indications for use, vitamin D is typically used when there is a vitamin D deficiency. And it can also be used prophylactically or preventatively in some other situations. Now, before somebody was to use vitamin D, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. A patient would not be able to use vitamin D if they had a hypersensitivity to cholecalciferol, ergocalciferol, or other vitamin D metabolites. And it would also be contraindicated in patients experiencing an exacerbation with enhanced toxicity with regard to hypercalcemia or high calcium. Now, in terms of precautions, this medication should be used cautiously in patients who have arteriosclerosis or other cardiac conditions due to the potential exacerbation related to persistent hyperkalemic effects at therapeutic doses. It should be noted that if vitamin D is used with other calcium-containing products or vitamin D-containing products, as well as thiazide diuretics, there may be an increased risk of hypercalcemia or high calcium. It's a good idea to use this medication cautiously in patients who have hyperlipidemia due to the potential exacerbation of LDL elevation. If a patient has hyperphosphatemia or high phosphate levels, it's a good idea to normalize phosphate levels before starting with vitamin D. There may be impaired absorption in patients who have liver disease. It should be used cautiously in patients who have renal impairment, again due to the potential exacerbation related to hypercalcemic effects. And finally, patients with sarcoidosis or other granulomatosis diseases may have enhanced sensitivity to vitamin D. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings and they start to use vitamin D, there's a couple different preparations as well as doses that they may use. If somebody is using the 1,000 unit per drop oral solution, they may use 1 drop once daily. Patients greater than the age of 50 who are instructed to use vitamin D may use 800 to 1,000 international units once daily. And it should be noted here that under the direction of a physician, up to 10,000 international units per day may be safe for up to 5 months. For patients using vitamin D for inadequate sun exposure, they may use 800 to 1,000 international units once daily. And patients who are pregnant or lactating may use 1,000 to 2,000 international units daily. Now, there's not much to say in terms of side effects with vitamin D. However, some people might experience constipation or nausea, and others may experience a loss of appetite. Now, a rare but serious side effect is something known as hypervitaminosis D. That's all we're going to talk about today with cholecalciferol or vitamin D. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.